Yeah, it's always so cool to watch the waves out there. It's like unbelievable. I wouldn't go in, but I would do it. And Josh, now you have left the studio, but you are somewhere very important right now.
Well, I'm right out in front, and we're in, in an RV, except this is not a camping RV, and the good doctor, Lisa Chips, behind me here, I'm waiting for my appointment with her, so we're going to talk to her in just a minute.
So you scheduled a doctor's appointment while you're doing a newscast?
I'm busy. I lead a very busy life.
I see.
This is a special RV. This is the Road to Healthy Skin Tour sponsored by Aveeno, and it really, we can't stress enough how important it is to take care of your skin here, especially during the summer months, but all year round. We're going to be talking about some tips as we make our way through the next couple of minutes here. But first, let's go back out here to the Road to Healthy Skin Tour. By the way, the doctor helped me out on this thing. You switch it around and then you do that. So I figured out how to actually do that. Dr. Lisa Chips, dermatologist. Tell me this first of all, which by the way is a new show on CBS. Dr. Lisa Chips, dermatologist. Tell me what the basic things I have to watch for, even on a cloudy day like it's going to be.
Even on a cloudy day, you need to protect your skin from ultraviolet radiation, UVA and UVB, by using hats, sunscreen, and sun protective clothing, and seeking shade.
Okay, so that's important. Like the SPF number, tell me what that means and what's the number I should be looking for?
The SPF tells you how much ultraviolet B protection your sunscreen gives you. Broad spectrum tells you that it gives you ultraviolet A protection as well. You should look for a broad spectrum sunscreen of at least an SPF of 30.
SPF 30. And is this stuff as good as anything else, spraying it on? I know my daughter loves to sit there and all day long. Yeah.
Spray sunscreen is great, but I always tell my patients to make sure they apply it liberally. You need to apply a lot of it. And
more than just once, right?
Yes, every 2 hours when you're out in the sun, more frequently when you're in the water.
Okay, fantastic. Coming up in a little bit, Lisa, I'd like to, we're going to take a look at some of the things that we want to watch for on our skin that might be some red flags out there. Out of the studio in the big RV, it's the Road to Healthy Skin Tour, sponsored by the folks at Aveeno. Tell me about this. What kind of things should I be looking for on my body, doctor?
So we advise everybody to look at their moles every month and do a skin exam, and once a year to see a physician for a skin exam. You're looking for anything that comes up like a pimple that scabs, bleeds, doesn't heal, or a mole that's changing, that's asymmetrical with irregular borders, color variations, or a large diameter. Those are things we need to all look for on our skin.
And so, and it's something that we should do regularly, just keep an eye out on what's going on, right?
Absolutely. Everybody should have a skin cancer screening once a year, and that's why this tour is so important, because it travels once a year all around the country to screen people who don't have access to care.
Right, so you're going to go to these neighborhoods and I can come on in and get a free screening, right?
Yes, these are free screenings. They're first come, first served. All the information of where the stops are is on the website, theskincancer.org.
Fantastic. And I've got a couple more questions for you about some things to look for. We actually are going to have one of our folks in the newsroom get checked as well. And of course, it is the Road to Healthy Skin Tour, and it's not too bad. Maybe a little patchy fog as we make our way into next week. How's Anselmo doing?
Anselmo looks great. He's got a few moles, but they all look like normal moles.
And tell me what you're doing. You're looking...
So I have a little magnifier, a derm light, that lets me polarize the light and take a close look at the lesions. And I'm able to see close up the pigment network within his moles and tell if it's normal or abnormal.
Now, something interesting here, and someone has a darker complexion. You think that skin protection, if you have a darker complexion, maybe some people think, it's not for me, I don't have to worry about it. But no, right, everybody.
That's not true. Melanoma happens in all races, all skin colors, and it happens both in sun-exposed and non-sun exposed areas. So it's important for everybody to check their skin regularly.
Really? Non-exposed areas?
Yes.
I'll be checking that in the commercial break. Layla Gulen, what's going on with the traffic?